$7,000 per head, you would have the cost of health care as it is today. It costs $7,000 per capita in the United States to supply health care to everybody that's living within our borders. Okay, if there's 300 million people and you're paying $7,000, that's $2.1 trillion a year is spent on health care. That's where that number comes from. What I'm going to tell you, if you need to spend less because the gross domestic product is less than that, or the share that should be spent on health care is less than that, then let's say that what we want to spend per capita is somewhere close to $500 a year. Well, if it's going to be $500 a year, then you're going to have a risk pool that enables you to cover 300 million people with only $500 a year being spent for their health care. How do you do that? I contend you do that where you have a random system where everybody has to buy the catastrophic insurance, and it's bought throughout the country by every man, woman, and child, and the amount would be maybe $250, $500 per capita. And if you did that, you would have enough money created in a pool to supply catastrophic health care to all those people at the tune of, when something catastrophic happened, they might have $1 million backup policy. And you can do that tomorrow. That's the way you do it. You can cut it any other way you want, but that's how you do it. Now, let's just say we went out and did that. We insured every single person for catastrophic insurance, and we took care of it. Now, everybody has catastrophic policy, but that doesn't get you from day to day. What happens from day to day is you have to go to the doctor, you break your arm, you've got a cold, whatever. You've got to have what we call maintenance health care. Maintenance means how we're going to maintain ourselves day to day. I would contend that almost every one of you either talked to a doctor, had know somebody that saw a doctor, had an operation or something. Everybody sees a doctor or some related person in the healthcare field every year. So if you do it every year, that's not insurance. That means you're just prepaying that visit that you made to the doctor. So I contend that right now you take all people that right now have health insurance, and I say that they get a raise, that whatever their business is paying them for health care, that money is put into their medical savings account, and with that they each year take portions of that out to buy whatever they're going to get for health maintenance. You're separating the two. You've got the catastrophic already taken care of, the way I just said, and then the maintenance is based upon the day-to-day routine. It is the day-to-day routine that people pay with their money that's sitting in their bank, and they get in their car and they go buy and purchase something. That's what drives prices down. That's what drives quality up, and that's what you want to happen from day to day. What does the medical profession have to do to change? They have to advertise. They have to say, if you come to me and I deliver your baby, I will do that for X amount of dollars. We'll do it at this hospital, and this hospital has to charge this amount of money, so you already know how much it's going to cost you. And then you will shop based upon the quality of the care they're given and the cost of that care. Then you will pick out where you go. So once you've established how much items cost, then when a catastrophic event happens, then it is a summation of what those market-driven prices are, and it'll be what it'll be. But you'll have the money aside that'll pay it if you need it, because you also have a catastrophic policy besides the maintenance policy. Now, this is a lot of stuff in 5 minutes. The thing I want to tell you, what won't work is you can't. These are all the type of insurance companies there are. And you can have a whole bunch of insurance companies, Blue Cross Blue Shield, Aetna, Cigna, whatever you want to call them. You can have a whole bunch of companies, you can have one company, you can call it the government company. You can have no company and it just be self-insured. I'm saying everybody wants to be independently self-insured, and I give them the way to do it. The reason you don't want the two company ways is because they have to take a cut in order to maintain their profit margin, and secondly, their interest is never going to be as much as your interest is. I always tell people, if you have the money in your hand, where do rich people go? The people that have unlimited amounts of money, where do they go? They go to the best they can afford to go to. Why shouldn't you? And if it's your money and it's in your account, then you'll pick out the best doctor and the best services that you can afford. So this is all hogwash except for catastrophic policies. Then we want a whole bunch of them sharing the risk. We don't want too big to fail. We want a whole bunch of companies doing insurance, and we want everybody for maintenance insurance to be self-insured but with pre-tax dollars. Now, the types of insurance, like I showed you, there's catastrophic, and that's the one where it's, hardly ever happens, therefore the companies can sell it to you for a low amount of money because it's not going to happen. It's like selling for $25, you buy an airplane insurance that says, if I get on this plane and I fly to New York and it crashes, my beneficiaries will get $1 million for $25. That's $25 for $1 million worth of coverage. And if we can do that on an airplane, why can't you do that across the country to individuals? The answer is you can. You just have to do it blindly, just like it's done when you sell flight insurance. Day-to-day maintenance is not insurance. It's day-to-day maintenance. It's just like how you buy and sell food. You either go to where you want to eat or you don't. You either spend more tonight or less in the afternoon. Whatever. You can manage it yourself if you've got the money in your account to do it. All right? And you don't want to be a slave. Remember, you want your money so that you can buy and sell your food. Over here, this is all the types of healthcare you hear talked about all the time. There's really basically what's called public health care, or the public option, or government-run health care. Government-run health care is Medicare, Medicaid, government employees, which includes Congress. All those people get their money from the government, which is you, the taxpayer. So you are supporting all these people, even though you may be self-insured or you have a commercial insurance. Your money that you pay is going to these people and not you. Okay? And some of these people may be freeloading, some may not. I'm not trying to distinguish freeloaders from non-freeloaders. I'm just telling you everybody ought to have coverage, but everybody has to play the game and has to play it fairly in order to keep the risk down and the costs down. All right, so does everybody understand that 50% of the money spent right now is spent by the federal government, but the federal government's broke? So what we want to do is we want to take all of this burden off of the federal government